everybody. Dr. Bupp here at Advanced Health and Wellness Center.
Hi guys, it's Leah Klein, the Physician Assistant at Advanced Health and Wellness Center.
So I think we have a really important concept to talk to you guys about today, and that is the difference between cortisone, like medicine, treating a symptom versus actually trying to improve function. So it's something that we deal with, we experience, we discuss with patients literally on a daily basis, and I think it's super impactful for your life. So I'll give you my kind of explanation, thought process on this, and then you can also tell me what you think too. Mm-hmm. So basically what we're looking at is when somebody's getting, like, say, a cortisone shot is a good example. Person has pain, they've had arthritis in the knee, or they've had some kind of an injury. They go to their primary care doctor and they get a cortisone shot. That cortisone shot is going to help with the symptom for that period of time. So if it works pretty quickly, and then it starts to trail off typically, if it's arthritis or if it's something that's more chronic. But it actually, the studies are really clear that it creates degeneration in the joint, or it causes damage, or it can cause damage. It can cause instability or weakness in the tendons, ligaments. It increases the aging of the joint. It affects blood sugar levels. It affects immune system function. So there's a bunch of different things that are probably negatives with that, versus if we were seeing somebody, we use regenerative medicine, and there's different versions of that. So we're looking at, like, using hyaluronic acid and rehab, or using this laser, class 4 laser, low-level laser, that stimulates mitochondrial function and actually has been shown to stimulate cellular activity, meaning cellular regeneration or cellular growth. And so in doing that, the goal is to get normal mechanism of the joint back. It actually usually takes longer, but the results are much more long-lasting as long as the person then does something to maintain them. So could you talk a little bit about that, because you have experienced both worlds?
Yeah, sure. So it's really common in the orthopedic world to do cortisone injections for somebody that has pain in a joint, and they're very temporary, and it will wear off, and there are some damaging effects. So as far as long-term prognosis, you're going to end up with what you started with or worse, because it doesn't do anything to reconstruct or heal the joint that it's injected in.
Which is why people do them like multiple per year.
Yes, some people can do them every three to 4 months continuously, unfortunately, because then you're just doing more damage in the long term.
It depends on what you want, right? Mm-hmm. A lot of it depends on what you want. So we're talking to people about, hey, let's get this joint working right, let's get it moving right, let's improve the strength, let's improve the mechanics. Mm-hmm. And sometimes people like, thanks, doc, but that's not really what I'm interested in. I just want it to feel better now, right?
Sure, if you want your arthritic joint to feel better for 3 months and then just keep getting more arthritic, then that's your go-to.
Oh, jeez.
Keep it. You can keep it.
But sometimes that's what people want.
Uh-huh.
It's not a
relief. They just want relief. Mm-hmm.
Want to put in the time to get a joint that works better again,
right?
Or the money, or whatever it might be. So, anyways, regenerative medicine.
Mm-hmm. So regenerative medicine, there, like you mentioned, there's a few different options that we use as far as regenerative medicine goes. It really depends on. Yeah.
Sorry.
That's okay.
We just kind of started a new process that has insurance helping to cover some of that cost that we're kind of excited about. Can you go through kind of the steps of that?
Yeah, so we've been using hyaluronic acid injections. This is the gel shots. You might have heard it called the gel shots or rooster comb. There's a few different brand names, and we've been using those since I started in the office, and we just weren't getting the long-term results. So it's similar in like to cortisone in that it wears off, but it's more natural because it's just a gel material. Hyaluronic acid occurs naturally in your joint fluid, so it's more natural as far as that aspect goes. It just doesn't last long. It's not a healing procedure, but it does give you some lubrication in the joint. So
And we can start with that.
we can start with that. So yeah, we're finding that we can use that simultaneously or before or after umbilical tissue injection or PRP or whatever regenerative therapies that we choose, and just kind of help lubricate the joint even further. There's actually natural hyaluronic acid in the umbilical tissue, so we're just kind of continuing to lubricate and help heal the joint.
Well, and kind of the concept is we're getting that stage one would be get lubrication, increase the joint motion and reduce the inflammation, set the stage for the regenerative medicine to work better, and it actually allows us to lower the cost on the regenerative medicine, so we're really excited about that.
Yeah, definitely. We can get a head start on rehab that way, and then we're not doing as much follow-up with rehab after the umbilical tissue or PRP.
And what's the goal of regenerative medicine? What are we trying to accomplish at the end of the day?
We're trying to get your body to heal your degenerative joints. So instead of progressing further in degeneration, which always will happen unless you do any kind of regenerative therapy, we're wanting to stop or even reverse to a degree the process of degeneration and get the body functioning better so you can walk and stand and play with your grandkids and do the things that you have been lacking because of your pain.
And that does what for the joint, the S word? Stabilize, right?
Oh yeah, definitely. It's a lubricating, stabilizing, cushioning material that we're using.
When you have better function in the joint, you are going to have more stability,
Definitely.
which means less likely to have pain and less likely to have injuries. And so long term, it's a really, really good solution. So I think that those are the two. That's the difference, right? You've got more of an immediate but temporary relief versus sometimes it takes longer. It's kind of a process for regenerative medicine to work, but it also, if we can get function back to the joint, we can get stability back to the joint, and that gives us long-term changes in relief.
Definitely.
If you have any questions about that, please let us know. We'd be happy to answer them. And it's exciting for us to see where people have now been 3-4 years with very limited pain in these joints. And again, sometimes there's, it's not 100% for everybody, and there's different things that work better for other people, but it's absolutely worth evaluating what your options are, because nobody should be living in pain.
Right.
Anything else?
No, I don't think so.
All right. Have a great day. Enjoy the sunshine, and we'll talk to you soon.
Bye, guys.